Good morning, everyone. Welcome to the May, can't believe it's already May, GHA user group meeting. We'll give it a few more seconds to let everyone in from the waiting room. Sharifa, if you'll just let me know when everyone's in. We're good. Okay, so we'll begin then. Thank you for joining us. This meeting is being recorded, and this meeting is to just have an open forum for discussion for the Georgia Discharge Data System and the tools that are used with that data. So we're going to review the data submission update, the timeline, a new verification report, and the publication of the economic impact report. And also at the end, we'll review a few of the services and tools that we have available for you as users. I want to also introduce our GHA staff, which is Sharifa Navos, Bill Wiley, Stephanie Taylor. I'm not sure if Samantha Dulworth is probably going to join us. And I'm Leslie Sainovich, Senior Director of our Data Services Department. So we'll go in and get started. Please keep yourself on mute unless you have a question, and then please feel free to unmute yourself and chime in or ask a question. We'll also be monitoring the chat if you'd prefer that venue to ask your question. So just as always, I like to give a quick overview of what the Georgia Discharge Data System is. Hospitals submit their data to our vendor, Heidi, in the UB04 format. That data is then processed by our vendor, Heidi, and run through a series of edits and validations. And then the Georgia Discharge Data System is generated. GHA receives a set of that data. And that data is also submitted to the Brain and Spinal Trust Fund Commission on your behalf, to the state of Georgia as required by the law, and to the Agency for Healthcare Research and Quality and the Healthcare Cost and Utilization Project. And what that does is it allows for AHRQ to vet any research requests, and then we also vet them as well, but allows us to manage that process through the Healthcare Cost and Utilization Project. We are, wrapping up, trying to wind down the 2020 data submission, and Sharif has been digging through data submissions to try to find any anomalies so that she can bring them to your attention and have those corrected so that when we close the database, it is as accurate and complete as it can be. The deadline, our target deadline for closing that database is July the 15th. And or for you to submit your final set of data by July 15th, and then we want to close the database and be able to release it by the end of July in its final state. And once that happens, there will be no more changes accepted to that data. So if you have any questions.
Oh, sorry. I'd like to add too that if you have to, resubmit, multiple months or the whole year, you can do it by quarter. So you can do it 3 months at a time, so that way it'll be 4 files that you're submitting, just so that you're aware that you can do that through HeidiNet.
And just a reminder too that before you resubmit, you need to delete this previous quarter that you've already submitted. Correct, Sharifa?
Yes, correct. And then you resubmit the new file. Correct.
And if you have any questions, or if you'd like kind of a one-on-one 10 or 15-minute review of your data, Sharif and I would be happy to get on a call or a Zoom with you and just let's review your data together to make sure that we agree that everything looks as it should. Sharif is going through it, but if you would like to do that, we'd be happy to meet with you. So just give Sharif or myself a call and we can set that up for you. Our 2021 submission is moving right along. Sharifa, do you want to give us a quick update on how submission is coming?
Yes. So last week we had the February data that was submitted, and so thank you for submitting on time. And so this I guess in about 10 days on the 15th, March data will be due. So that'll be Q1 data. And again, you can always resubmit previous, previous months, if ever there was an issue with your January, February file, because it gets refreshed around that time. And so if you have any issues doing your submission, please let me know in advance. And like Leslie said, I'll also be monitoring and emailing you, you know, if the data is not in or if it's incomplete, or if you have any questions, contact us also regarding the submission. But again, thank you for submitting on time.
Are there any questions surrounding the submission schedule and submission itself? Again, a reminder that as you submit, the edit summary reports are emailed to submitters, and we request that if the submitter doesn't review that report, that it's forwarded to the appropriate people or person to review those reports. Also, the edit detail report can be found on HeidiNet, as well as the verification report. Those are processed immediately as soon as the data is uploaded and processed.
And someone asked in the chat where they can find this schedule, and it is on our website, gha.org. You would go to the data tab under Georgia Discharge Data System, and then there's a Data Services Resources button that has schedules and other pertinent information. It also has the presentation from today, you know, from those meetings, from the user group meetings, our notes to the study, and other resources. So you can find that on the website. If you have any issues finding that, email me. And I can, oh, here you go. So Leslie's showing you. So you go on the website, Georgia Discharge Data System, and when you click on there, that blue button is where you'll find the schedules and other data related resources.
Right. So I think it's on GDDS resources, probably the schedules on here. Yep, the monthly submission schedule is right here. So I'll keep that open because we may come back to that when we're talking about accessing some other reports. Sharifa, do you want to share with us about the upcoming release of a new verification report? We've talked about this over the last couple of months, but it's going to be released probably mid 3rd or 4th week of May. Sharifa?
Yes, thank you, Leslie. Yes, so the verification report, like you mentioned, or like Leslie mentioned, is generated every time you submit a new file on HeidiNet, and then you can use that to kind of have an overview of the data that you submitted, making sure that your volumes and distributions are correct, and then there's a comparison to the previous year just to make sure that you're on the right track. But unfortunately, with 2020, the data has been much different, especially starting around March, April of last year, and so we wanted to have a 3-year comparison chart for you guys to be able to skip 2020 and not use that as your main comparison year. And so that new verification report will have that information so that you can still see that you're in the right, I guess, in the right scale, or you're trending.
Range.
Yeah, you're the right range in terms of your volumes and your distribution of data. And so that'll be in an Excel format. It'll be posted on the HeidiNet website. And, you know, we've had Heidi develop that for you so that you can have a better look or a better comparison of your data. And I don't know if you want to add anything, Bill or Leslie.
Well, it's kind of like I hate to say it this way because everybody hated statistics in high school and college. It's almost like your standard deviation. Well, we know 2020 was outside of your standard deviation. So this is a way to kind of exclude that. And if your submissions in 21 look more like your submissions in 18 and 19, then we can make the assumption that the submission is valid. So it's just providing a range and a snapshot so that we can exclude hopefully the outlier that was 2020. And the reason we were targeting May, obviously March is when most of that started to occur last year. And so we knew January and February would be comparable, 2021 to 2020, but we wanted to target May so that we could have March data applied with this new verification report. If folks like it, we'll continue with it, but really it's designed just for 2021. When we get away from the pandemic.
Yeah, and feel free to give us your feedback too. when it's released, so that we know that, you're using it and it's something that's helpful.
And also we'll send out a notification when it goes live, when it's available. And also keep in mind that the report is available on HeidiNet, not the strategic planning tool, but the HeidiNet website is where you actually submit data. And so not everyone on this call may have access to HeidiNet. So if you have questions about who in your organization has access or will have access to this report, just give us a call and we can let you know. Any questions about the new verification report? All right, then we will move on. This is kind of just what we talked about the methodology and why we generated or requested Heidi to generate this report.
Yeah, and this is where it's located too, the one that's generated under the report section. And that's going to be generated as well. So you can use that also, when you're looking at your data.
Great. Next, we wanted to talk about the release of the annual economic impact report. This report is generated every year and uses a combination of several different data sources, one being your annual financial survey, as well as the hospital annual questionnaire. And then this year, we also were able to use the cost report data, and that allowed us to incorporate things like contract labor and get a whole picture of your hospital's wages and salaries. And so that allowed us to, we felt like, and we vetted that with one of our partners, actually, Draffen and Tucker, correct, Bill?
Yep, West Sternenberg. Yep.
And also with several of the hospitals, we kind of said, does this pass your smell test? And not only your smell test, but does this pass what you submitted in your cost report? And they, agreed that it did, and that they like that methodology. So we were able to, every year we try to, fine tune the report a little bit. And so each hospital gets this report and a system report if your hospital is part of a system. Bill, do you want to add to this? And then I'll point out where this report can be accessed.
No, I'd be happy to. Yeah, this is one of our more popular reports that we put out each year, simply because of it shows, excuse me, how the hospitals are interwoven in their communities, not only from a healthcare standpoint, but as one of the largest employers and one of the largest industries in the state. As you can see from the cover, there were over 162,000 FTEs. Now, this is FTEs, not necessarily employment. So we believe that more than 162,000 people are employed by hospitals. And the hospital spending impacted more than $65 billion on the economy. So that is a significant number. We've got more detailed breakdown, I believe it's even on the next slide, of the numbers at a state level. So hospitals alone spent $28.4 billion. The $28.4 billion is almost 4.5% of the entire state domestic product. So 4.5% of the entire Georgia economy is related to hospital spending. And the 160-something thousand employees is almost 4% of the entire Georgia workforce. So, these are significant numbers. And we're very pleased that the hospitals can use it. So all the hospitals get a report that looks just like this for their own hospital. Like Leslie said, if they're part of a system, we do a consolidated system report, and they'll get the comparison for the state of Georgia. Over in the top right corner is a dashboard that we do that breaks it down by your individual MSA, by your individual legislative district, and then again by the state of Georgia. If you're a rural hospital, that your MSA is by definition rural. So like Leslie said, we work with Draffen and Tucker and West Sternenberg specifically to identify additional areas that we could look for to show the true impact of the hospitals. Hospitals are much more complex than they were 10 years ago. So we were looking at ways to show system level impact, physician practice impact that's owned by the hospital system, corporate offices, things like that, to really show the overall expenditure. And we think this report this year reflects just how complex and a more accurate number than when previous reports that essentially used the Department of Community Health's hospital financial survey. So it was hospital operations only. So that would leave off any ancillary services like nursing homes and things like that hospitals ran. So we think this is a much more encompassing of the 155, 160 hospitals that were reflected in this number. Also, and I didn't mention this, also in the reports, there is a template press release that you can use with your own local constituents to show how your hospital specifically impacted the community. We've set that up with quotes and a little more context for how you can use that within your local community.
So, Bill, tell us who has access to these reports.
All the C-level has access to the report, as well as PR, specifically PR because of the economic impact report. But we can allow anyone within the hospital to have access. We would like permission or the request to come from, a C-level individual to say, hey, give this person access. But there really is no restriction on the number of people. But if you are a PR in the PR Society or a C-level hospital employee, you automatically were enrolled in the member report folders.
So the member reports folders are here, and then where you'll see your hospital name, and then you'll see economic impact. And what we've done is we've grouped previous economic impact reports in this grouping 2015 to 17, 2018, and the year reflects the year of the data that was from, that the survey was from. So it's always kind of 2 years in the rears. So even though it's the 2021 release of the economic impact report, it's based on the survey data that was submitted for 2019. So this is where you would come to find your report. There's the summary is the dashboard. There's the press release template that Bill was referring to. We also put the rural MSA out there, and then there's the hospital itself, the hospital's report, which includes the state of Georgia page as well. So any questions regarding the economic impact report? All right, if not, Stephanie has some new data to share with us. Stephanie?
Hi, good morning, everybody. Yeah, thank you so much for the opportunity to present this. This is some additional information to accompany the economic impact report for 2019 data. This first sheet, we have them for each metropolitan statistical area. I'm going to show this first slide is for rural, and the second slide I have is for Atlanta, just for examples. But of course, we have like Albany, Augusta, et cetera, for both pages. So this first page is kind of like a social impact of, healthcare factors or health factors within each MSA district. Of course, we're showing the makeup of the general population. Additionally, on the far right, we have a bunch of social factors such as population, children and households, college, food insecure, and and a number of different ways people die, but before their time, which, of course, when accidents occur, that also increases our hospital usage. Additionally, in the middle part, we have future factors, which kind of is a snapshot of things that are going on with our children, and things that we need to think about, going forward, because as you can see, a large percentage of children are at risk for health factors when they're older, such as, a very large percentage for food insecure, children in poverty, single parent homes. Oftentimes those don't have the best outcomes, and disconnected youth is, children that have dropped out of high school, are already in the juvenile justice system, and people can't reach. And as we can see in the rural population, that's 20% of all youth, which is incredible. I mean, those are future, jail inmates, future, drug abusers, substance abusers, bad eaters, etc. So it's something to consider. And below we have health factors for, for the rural population here. As we can see, insufficient sleep is the top issue for this population, as well as obesity. On the far right, it did break it off a little bit, and that's 15% of the population that of adults with diabetes. And I believe, frequent mental distress and physical distress are also very concerning factors, since, that of course goes hand in hand with chronic health issues. If y'all don't have any questions, we could go to the next slide. Yes, and this is just a kind of different, a snapshot of the economic impact report. For this page, we pulled out Atlanta. It shows the population of 2019, the percentage of people over 65, percentage of people uninsured. And, probably most important to health, to our hospitals is the breakdown of, of community charity care that we provide. As you can see in Atlanta, bad debt is very significant, and indigent care kind of wins out for, for the highest percentage of dollars used to give back to the community without payment. On the bottom left, we have totals of our household earnings, which, is approximately, it goes into the billions of dollars for Atlanta. Additionally, 7.5% of jobs created in Atlanta are directly related to hospitals. Is working in the hospital or a hospital supported employment. So could we go to the next slide? Yes, and this is just kind of an overview comparing 2019 and 2020 outpatient discharges. As you can see, on the top right, outpatient discharges by date, of course, we had the large dip, but we can also see that, outpatient discharges through the rest of the year, obviously, it did not completely recover post-COVID. So that is something big to look at. Additionally, we can look at, the differences of outpatient discharges by type. And we can also see on the right of select procedures, obviously 2020, we've had a lot less MRIs and mammogram. Well, we've had more mammograms and more cancer patients, but physical therapy is down quite a bit. Colonoscopies, various different procedures that we offer. And going forward, we're going to be breaking this down by month. And also, most importantly, there are, tens of thousands of patients that, in 2019 would have seeked outpatient care by our Georgia facilities. And we need to figure out what happened to those tens of thousands of patients that still haven't shown up. You know, whether they might show up in 2021, whether they'll be sicker, you know, if they'll need different procedures because of their delayed care, you know, et cetera. So that's really all I have right now. Does anybody have any questions?
Thank you so much, Stephanie.
I was just going to say, we thought it was important to add some of those social determinants of health along with the economic health of the hospitals and their patients, just to give more of that context throughout the whole report.
And we had a question in the chat regarding the hospital reports, and I responded, you know, that you would need your mission of a C-level staff
just
member.
have them email either me or Sharifa, and we'll get you set up. We just do that so we can make sure that everyone that has access is the folks that need it to those folders. There's nothing in there PHI related, but there are some sensitive reports from the standpoint of quality scores and financial modeling and things like that.
Right, and those folders are on the GHA website, which is a wonderful resource, and you do need a login to get into the GHA to get to the data page. And so if you don't have a login, it's really easy to set it up. And there's lots of good tools and resources, not only from data services, but from all parts of GHA. So I encourage you to make sure that you have a login to GHA. And in that, on that tone, what we wanted to talk about next was just about some of the data services resources that are available, and make sure that you know they are available, whether or not they fit into your area of interest or not. Someone in your facility could benefit from using some of these tools, and one is what this meeting is centered around, is the GHA strategic planning and visualization tool, and I'm going to pull that up in just a moment. But also the quality folks, you know, we're talking more and more to the quality folks in your facility, and we do have a readmission part of the visualization tool. It requires a little bit more authorization because you are able to drill down to the patient level in this readmission tool. It shows your hospital's readmission to your hospital, but also if that patient discharged from your hospital was readmitted within 30 days to another hospital, that patient would be flagged. It's not going to reveal what hospital that patient was readmitted to, but it'll just say to another hospital. So, and this is a tool that was developed strictly for quality improvement. It's not a predictor on your any readmission penalties from CMS or anything like that. It's just a quality improvement tool for quality departments to utilize. And so also we've been talking about the GHA member reports, and that those are the reports where the economic impact report is housed. Also where the reports we publish from Haney's are some of those are proposed rule reports. Bill, you know, we sometimes give a sample of those in this meeting when there's a significant report published, but that's where all of those reports are placed. And I also wanted to mention, you know, we do offer a quality reporting tool called Quality Works, and that is partnering with Quality Works to take your discharge data, and it's where you can do your chart abstractions, and we submit that data to CMS on your behalf. So it's a whole different program, but just wanted to make you aware that it exists. We have about, I guess we have about 50 hospitals that participate with that. You know, and I'm sure many of you already have a vendor that you use, but I wanted to make sure you were aware that we do have that available. And Samantha Dulworth manages that program. So if you had any questions, you can contact Samantha or myself. We also have available the Culture of Patient Safety Survey, which many of you have utilized that service, and Samantha Dolworth also manages that, and we'd be happy to work with you. We have a really good vendor, the Center for Patient Safety, who helps us administer, or who actually administers that survey for you. And the survey also is not only for hospitals, but there's kind of an add-on for medical offices, pharmacies, the other surveys that are available. They can administer that for you as well. So if you have an interest, we can, talk with you about, the cost of those surveys. But just wanted to make sure that you were aware of all of the services that we offer. And with that,
and someone in the chat, Leslie, asked when the Q121 or the limited data set
for quarter 121. I have been processing all of the limited data set requests and the DocuSigns for that. So if you are still interested and you haven't received that DocuSign or sign, or let me know that you want it, please notify me and we'll get that moving. But that limited data set should be released by the end of May, the first week of June. I think the schedule says June 7th. But usually we've been getting it a little bit earlier. And in addition, we are looking at the potential of releasing that data monthly for those who are interested and those who can, digest that on a monthly basis, that amount of data. So, but that should be by the first week of June, to answer your question. Another question that came up in the chat, Bill, is regarding our unclassified outpatient data.
Yeah, we have been working with Heidi on a way to get that. We think what we would prefer to do is get this in a separate file. That way, one, it doesn't just overload the first and really have some processing issues from the hospital standpoint. The other thing that we're looking at is what we're required to submit to the state. We think these are going to be considered unclassified or I forget our own term for it. It's not unclassified, but
there's unknown
patient type. Yeah. So we can make sure that we don't have to submit that to the state, since most of these are more along the lines of your non-hospital related services. So we just want to be careful with how we do that. And that's the plan at this point. We're going to work with Heidi to get a separate file for it.
So we are working with our vendor Javion's, that like Bill said, we don't want to overwhelm the system. So one of the things, and kind of behind the scenes, is their technical team is looking at is, if we load that amount of data, can the system automatically, when you log in, exclude that data unless you specifically go in and select it to include in any of your filtering? Because we don't want to bog the system down for everyone just by putting a whole nother chunk of data on there for it to process every time you make filters or choose filters in the tool. So that's another thing that we are working on it, but that's another factor that's playing a role. Any other questions regarding that? I was just going to show you quickly, on the GHA webpage regarding the other services that I was just speaking about, there are some information that you can look at for the culture of patient safety, on Quality Works, on the Georgia Discharge Data System, and if you need to have new users added to the strategic planning tool, those forms are under authorization forms, or Sharif and I would be happy to just email you one. And the other thing, we're updating all our forms because we do have a new address. Wanted to make everyone aware of that. It's included in all of our emails, but we do have a new mailing and physical address to make everyone aware about. The other thing I just briefly wanted to show, because I think it's been just a little while since we've had the visualization tool up for you. So I wanted to just give everyone a quick overview of what that tool looks like. So this is our market trend analysis tab. And I think we may have had a couple of new users. So I just wanted to give a brief overview of the tool. Or if you have any questions or there's something specific that you would like to see, please let me know. The market trend analysis tool basically, just gives head counts of visits to the hospital. The defaults basically look at from 2019 to, well, there's 5 years worth of data in here. So you can filter on whatever time frame you prefer. And yes, it always defaults to the first of the month, even though it is going to include through the end of that month. So it's always going to say 1/1 or 2/1 or whatever, but it does include the entire month. You can filter by facility. You can filter by patient type. And right now it defaults by selecting all of the patient types. One trick that we recommend is that when you begin filtering, you go down to the bottom of this screen and you click pause, because that will allow you to filter without, every time you select something, it will refresh the visual little quadrants below. And so this will allow for a little bit faster filtering. If you're looking at, you can choose to look at number of records, or you can choose to look at length of stay, average length of stay on what is the counts that are returned. I'll leave it at number of records. You can also choose, especially if you're looking at your particular geographical area, you might want to just say, let me see the top 10 hospitals, especially if you were looking at Metro, Atlanta. We'll look at 2020. And let's just look at ER. And let's just look at county. And you can see it pulls up counties across the nation, because we have patients obviously that visit our hospitals. This is the patient, from where the patient originated, what their home address is.
And like Leslie stated, make sure you press that pause button, because the lag time will be significantly longer. If you don't, especially if you're selecting county and all that, it'll take us some time. So the pause button for both those modules at the bottom is very important. And then once you're done, you can click on resume.
So even over the Zoom meeting, it's pretty quick. I did very broad choices or selections. And so what it's returning is, for 2020, it's given me the top 10 counts of emergency room visits for those counties that I selected on this list. Okay. Then on the next quadrant, it's breaking it down by the number of records by zip code. And you can see here, there's a gray bar where you can, scroll. And then here it's giving you those records by the primary payer type and the overall group. Any questions? All right, the next tab, just to give you a quick overview, highlight, especially for anyone that might be on this call for the first time. You have the same filtering capabilities here, and the same, ability to pause your filtering so that you can make your selections. The difference here is that you have a geographical map, and you can actually, zoom in and click on the particular county that you want to focus on, and you can apply, patient type up here. And I must not have hit I did hit the pause. But anyway, this is more of a kind of a heat map that will allow you interactively to click on counties. And once you click on a county, it updates the other quadrants as well. And this can be used, you know, especially if you're wanting to look at a specific service line, you can look at where your patients are coming from. By service line, you can look at it by the major diagnostic code for inpatients or category. You can, you know, zone in on specifically on care service lines for outpatient. But it's just a tool that allows you to, you know, see out migration or where your patients are coming from or where they're going to. Here we go. So that is the market analysis for a county. Then I'm going to skip over revenue code analysis. Revenue codes are helpful, but it's not giving you a head count. It's giving you a revenue code count assigned to a patient, and a patient, as you know, can have, you know, many revenue codes assigned to that person. So I'm going to skip over that for now. I think our DRG analysis tab is very helpful because it's showing you, you know, the inpatient service line, and then it breaks it down further by DRG. And so you could, you know, look at your facility, you could look at a particular county, you can look at a set of zip codes, you know, these are all going to pertain to inpatients, but this is a very helpful tab as well. It also breaks it down into age bracket and payer type. And our last tab is the data export tab. And if you wanted to, on your own, generate a custom data request or data set, this would allow you to do that. So you could select your filters up above, and then down below in these columns, these select sort columns that are boxed and you know, black, are the columns that you want to output. So you will filter on the data above, and then you could select up to 5 columns to output. And you can only output a quarter at a time. So, you know, we have a little bit of a tight rein on this page as far as what can be exported or the amount of data that can be exported. But if you're looking just at a small data set, this would be a pretty easy place to come and generate your own custom data request. If this does not meet your need, of course, you can contact me, and we will be happy to work with you on generating a custom data set if that's a need that you have. Any questions? Anything else anybody would like to add? Well, I won't take up any more of your time. We really appreciate everyone calling in. If you think of something after this call that you meant to ask or that comes up, please don't hesitate to give us a call. Our contact information will be on the next page. Our next meeting will be June the 2nd, and we look forward to seeing everyone then. Here's our contact information. And in the meantime, thank you for all you do, and please stay safe. And we look forward to talking with you soon.